Hello everyone. Today I wanted to talk to you about the hand washing that we're required to do to keep ourselves safe during the COVID-19 pandemic. Hand washing and social distancing are the two most important things we can do at this time to reduce the spread of the virus. So these are very important activities. With hand washing, the reason it works so well is because the virus has a layer of lipid which forms its outer coating, and this lipid is broken down by the alkaline pH of the soaps that we're using. And once this is broken down, it deactivates the virus. So this is a very important activity. However, like many things, there are good effects and there are bad effects. And the bad effect in this case is that because the alkaline environment is created, the pH of the skin normally tends to be acidic, and the result of this is a reduction in the normal barrier function of the skin and a reduction in the normal bacteria or microflora that live on the skin. And as a result of this, many of you may be noticing that your hands are becoming more and more dry. They can become quite scaly. They can even become quite red and sore. And in some cases, your nails as well can become quite dry and cracked from this repetitive washing. So what can you do to minimize the effects of excessive washing, which you must continue throughout this entire period that we're required to protect ourselves? Well, there are three things you can do. Immediately after washing your hands, I would recommend having nearby, so you don't forget to do it, some form of moisturizer or emollient as we call it, so that you can apply to quickly replace the moisture that has been lost from the skin. In addition, you shouldn't be too obsessive about getting your hands clean. In other words, you shouldn't try to scrub your skin as well. Remember, all you're advised to do is wash your hands in a thorough way for 20 seconds, only 20 seconds. So there's no need to go further than that and use rough and things like towels or exfoliating puffs or anything in addition to scrub the skin, because all you may be doing is damaging the barrier of the skin even more and actually creating more opportunities for bacteria and possibly viruses to enter the skin. And the last thing you can do is avoid using extremely hot water on the skin, because again, this can cause more damage to the skin and make your eczema even worse. Some patients have asked me, but what cream should I be using on the skin? The truth is there's a wide range of very good moisturizers. None of them are expensive. Many of them are available over the counter in the well-known pharmacies around the country. Just to throw a few names out there that you may know, and none of them are my particular favorites. They all work very well. There is E45 cream, Dipro base cream, double base cream, Cetraben cream. And Aveeno cream has an interesting aspect to it in that they use oat in their product, and that is supposed to be prebiotic, and that may be helpful because I've already suggested that the microflora or bacteria in the skin can be affected by repetitive washing. Remember, a lot of the things I've described can also occur if you use alcohol-based washes. And typically, if you want to have a good antiviral effect, that alcohol must be approximately 60 to 90% in concentration. But the same issues may arise. And so even if you're using just simply alcohol-based hand washes, you still need to consider using regular moisturizer with these products. In the meanwhile, stay safe.